Hello everyone, welcome to my YouTube channel. Today we will discuss about tetanus. Tetanus is an acute toxin-mediated disease caused by Clostridium tetani. It follows wound contamination under anaerobic conditions. It is non-communicable and natural infection does not confer any immunity. In surgical practice, tetanus remains relevant due to its association with traumatic wounds, burns, surgical procedures, and unsafe injections and obstetric practices. Tetanus has declined in India due to the universal immunization program. Neonatal tetanus is also eliminated. Adult tetanus persists due to lack of boosters. High risk individuals include elderly, agricultural workers. Individuals with contaminated wounds and delayed wound care are also at high risk. Tetanus is a non-communicable disease despite having a bacterial origin. Tetanus transmission occurs through environmental exposure when spores of Clostridium tetani enter the body through the breaches in the skin, through penetrating wounds from nails, thorns, and splinters, lacerations and crush injuries, burns and necrotic tissue, surgical wounds and unsafe injection, umbilical stump in the neonates. The organism does not invade healthy tissue and does not spread systematically, and manifestations result only from toxin production at the site of inoculation. What is the causative organism? It is Clostridium tetani. So the causative organisms include it is a gram-positive slender bacillus with a terminal round drumstick shaped or tennis racket shaped, which is an obligate anaerobe. It is a motile bacteria present in soil, dust, as well as in animal feces. Grows only in anaerobic conditions with the tetanospasmin and tetanolysin as the virulence factors. It consists of two toxins, tetanospasmin and tetanolysin, where tetanospasmin is the neurotoxin and lysin is a hemolysin. It is responsible for the clinical features. Tetanolysin, however, has no significant clinical role. Tetanus is entirely toxin mediated. The organism remains localized at the site of entry. Sequential steps in pathogenesis include entry of the spores into the wound, germination under anaerobic conditions, production of a tetanospasmin, neural transport of the toxin, blockade of inhibitory transmission. So after the wound gets contaminated, the entry of the spores happen. There will be no local tissue invasion. Spore germination will happen under anaerobic environment. It is a vegetative bacteria. Release of tetanospasmin increases the systemic toxicity. It is transmitted through retrograde axonal sprint, indicating CNS involvement. Inhibition of the GABA as well as glycine receptors, which is through loss of inhibition. And sustained depolarization happens because of rigidity and spasms. Tetanospasmin binds irreversibly to presynaptic nerve terminals. It is transported retrogradely to the spinal cord as well as the brainstem. The toxin leaves synaptobremin, prevents the release of inhibitory neurotransmitters from inhibitory interneurons through gamma-aminobutyric acid as well as glycine. This results in the disinhibition of motor neurons and autonomic neurons, producing sustained muscle contraction and autonomic instability. Recovery occurs only after regeneration of the new nerve terminals. Types of tetanus. Generalized tetanus, it is caused, clinical features include trismus, dysphagia, generalized rigidity, and spasm. Localized tetanus, where there will be rigidity limited to muscles near the wound. Cephalic tetanus, cranial nerve involvement following head injuries. Neonatal tetanus, inability to suck, rigidity as well as spasm. Clinical feature, the incubation period ranges from 3 to 21 days. Shorter incubation periods are associated with the severe diseases. Main clinical features are trismus, dysphagia, neck stiffness, and truncal rigidity. Muscle spasms are stimulus induced and may involve the respiratory muscles. Facial muscle involvement results in risus sardonicus. Autonomic dysfunction is present in tachycardia, hypertension, hypotension, hyperthermia, as well as excessive sweating. Conscious is preserved throughout the illness. Diagnosis is mainly clinical, no confirmatory lab tests are required, and spatula test is only supportive. Management requires ICU care that includes airway protection, sedation, muscle relaxation, administration of human tetanus immunoglobulin to neutralize the unbound toxin, surgical debridement of the wound, antibiotic therapy with metronidazole, control of autonomic instability, initiation of active immunization with tetanus toxoid. Vaccination schedule at 6, 10, 14 weeks, it is pentavalent, 16 to 24 months booster doses, 5 to 6 month booster dose, as DPT, and 10 years and 16 years it is given as TD. In pregnancy also it is given as TD, 2 doses of booster. Cause of death in tetanus is usually due to respiratory failure, aspiration pneumonia, fatal cardiac arrhythmia, circulatory collapse, acute renal failure, multi-organ dysfunction syndrome, and mortality is higher in generalized tetanus, elderly patients, and those without access to intensive care. Complications in respiratory system include respiratory muscle spasm, diaphragmatic rigidity, laryngeal spasm, hypoventilation, acute respiratory failure, aspiration pneumonia, ventilator associated pneumonia. In cardiovascular system, autonomic instability, tachycardia, bradycardia, hypertension, hypotension, cardiac arrhythmia, myocardial ischemia, and sudden cardiac arrest. In nervous system include generalized muscle rigidity, painful relaxed spasm, autonomic nervous system dysfunction, exhaustion, and sleep deprivation. Musculoskeletal system include vertebral compression fractures, long bone fractures, muscle tears, joint locations, and rhabdomyolysis. Renal system, acute kidney injury secondary to rhabdomyolysis, myoglobinuria, and electrolyte imbalance. Metabolic system causes hyperthermia, metabolic acidosis, dehydration, hypocalcemia, hyperkalemia. In gastrointestinal system, it causes dysphagia, malnutrition, stress ulcer, gastrointestinal bleeding, paralytic ileus. Respiratory and GI interface, it causes aspirations of secretions or feeds leading to pneumonia. The ventilator-associated pneumonia, catheter-related bloodstream infection, urinary tract infection, and sepsis are infectious complications. With the prolonged immobilization, pressure sores, and deep vein thrombosis, multi-organ dysfunction syndrome can occur as general or systemic complication. So to summarize, tetanus is caused by Clostridium tetani, an anaerobic spore-forming bacterium that survives indefinitely in the soil, enters body through contaminated wounds. Under anaerobic condition, the organism produces tetanospasmin, a neurotoxin that travels along peripheral nerves to the central nervous system. It blocks inhibitory neurotransmitters such as GABA as well as glycine, leading to sustained muscle rigidity, painful spasm, and autonomic instability while consciousness remains intact. Manifest as trismus, dysphagia, and generalized muscle spasm, potentially fatal respiratory and cardiac complications. Immunization with the tetanus toxoid containing vaccines induces protective antibodies against the toxin. India achieved the elimination of maternal and neonatal tetanus as a public health problem through maternal immunization and safe delivery practices. However, adult tetanus continue to occur due to incomplete booster coverage and ongoing environmental exposure. I hope you have learned through this presentation. Thank you for watching.